Hey students, today I am so excited to be able to share with you how to look at your ATI Individual Performance Report that you get after you take an ATI test and use that information to develop a plan that will help you prepare and succeed to pass the next ATI test, but more importantly, to know that you are on track to pass the NCLEX at the end of the semester or at the end of your nursing journey. Okay, so the first thing that I want to point out to you is if you've taken any ATI test, you know that you get this individual performance report with your individual test score, and this right here is an individual performance report for your comprehensive ATI test. And this will tell you the probability of you passing the NCLEX the first time once you graduate from nursing school. So the first thing that I want to point out to you is that there are topics underneath the individual performance report. And this coincides to the NCLEX RN test plan in the under the NCSBN website. And the way that I got to this is I went to ncsbn.org and I went to the detailed 2016 RN test plan blueprint, and this tells you the percentages of questions that you will get in each of these category areas. So as you can see, the NCSBN website presents to you the information of the weight of each category in either a table format or in a pie chart. So for the purposes of this demonstration and to keep it simple, I'm going to be using the pie chart. The biggest section in this pie chart is management of care, which is comprised of 20% of it. The second largest is pharmacological and parenteral therapies, which is 15%. Then physiological adaptation, and then we have 9% with health promotion and maintenance, psychosocial integrity at 9%, basic care and comfort, and it just goes on and on and on. What I want to show you is that if management of care is 20%, then for your comprehensive ATI, the biggest number of question items should be management of care, and you can see that because 30% of the questions that you got on your comprehensive ATI were from management of care. The second largest category is pharmacological and parenteral therapies, which is 23 right here. And then the third highest is safety and infection control and reduction of risk potential. And it just goes on. I think I skipped 21, physiological adaptation. So I just want you to know that the ATI Comprehensive Report is a wonderful tool that really actually mirrors the NCLEX RN test plan. Okay, so now that we've covered those basics, it's really important that we know now how to pull for us the information that will help us know how to have an action plan for studying. First thing that I need you guys to do is get your individual ATI performance report and draw a line down the 80% mark right here. And the reason we get you to do that is because anything that is below 80% needs to be looked at immediately. And so I have listed from 1, 2, 3, 4. Anything that's furthest away from the line goes first. And that's the first thing that you're going to be studying, that topic. So if you look at this student's example, she needs to look at physiological adaptation. And I just say she because the majority of nursing students are a she. I don't know if this is a she or a he. But in this student example, physiological adaptation is number 1. And you can tell that this 14% I got from the NCLEX RN test plan from the NCSBN website. from physiological adaptation. So this is 14%. Then you go down, so for her individual score here, she got 57.1. So now we're going to go and move up and see which is the second lowest score that she got. And as you can see, 61.5 and 61.5%, they are equal here. So I went ahead and wrote that one first for basic care and comfort, and then psychosocial integrity. Now, based on the NCSBN website, both basic care and comfort and psychosocial integrity have the same percentage weight on the NCLEX blueprint. But let's say that basic care and comfort was 12%. Well, then I would keep basic care and comfort second, because if I got the same score on both basic care and comfort and psychosocial integrity, but basic care and comfort weighed more on the blueprint, I would put that first. But in this case, because this student performed the same on both these two items or these two topics, and they both weigh the same, it really doesn't matter which one this student starts on first. It just matters that it's reviewed and remediated on. Then we're going to go ahead and look at the fourth lowest score that fall below the 80 line, and that is health promotion and maintenance. So I've listed that as the fourth one, and as you can see, this is 9% according to the NCLEX RN test plan. You can see also that I've color coded them. Each of the topics, there's a total of 8 topics, and I color code them into red, yellow, and green. And I couldn't really do like a really light yellow because you wouldn't be able to see this, but this is supposed to be red, yellow, and green. And that's just a visual color representation of the areas in which you need to really focus on first. So you really need to focus on, if this was your individual performance report, you would have to focus on definitely these red areas before you take your next test. If you're short on time, you just want to focus on these red areas. If you have a little bit more time and you're not taking your tests right away, then you would want to focus on the red and the yellow. And if you have, an adequate amount of time, then you want to focus on the red, the yellow, and the green. Now, obviously, we only have 24 hours in a day, so many hours in a week, and then so many hours before you actually take the NCLEX or your NCLEX or the next comprehensive ATI. So this really shows you a visual representation of where you really need to focus your time. But we don't just stop there in figuring out where we need to focus our studying. What I also want to show you is that if physiological adaptation is this student's weak area, the NCLEX RN test plan has something for you to help you. And I'm going to show you that. Adaptation. Okay, so what I'm going to go ahead and do is I'm going to shrink that. Oops, and bring this up. Okay, so we're going to go to physiological adaptation because this is this student's weakest area. This student missed the most in physiological adaptation. So we're going to start right here. Now, the NCSBN website says that physiological adaptation is managing, providing care for clients with acute, chronic, and life-threatening physical health conditions. Content includes, but is not limited to, fluid and electrolytes, hemodynamics, medical emergencies, pathophysiology, unexpected responses to therapies, and alteration in body systems. So what that tells me is that this student's weak area is pathophysiology and lab results and test results on how to manage these things that we as nurses have at our disposal to manage these imbalances and alterations in body systems. So another thing that I want to point out to you is this. Okay. Let's see if I can find it. Physiological. The NCSBN website has really good sample items too of things that you would be able to see, that test items that you would see in that particular category. Okay, so what you can see here is assisting with invasive procedures, ventilator, peritoneal dialysis, suctioning, wound care, ostomy, pulmonary hygiene. So it's anything having to do with how you manage the care after something goes wrong with this patient. So I would tell this particular student to brush up on patho, as well as to focus on their individual remediation. And if you can see on this student's remediation, let's see. Oops. Physiological adaptation. So if a patient has gonorrhea, how would you assist this patient? Nursing process, assessing the needs of a client with an NG tube. Pregnancy, cardiac output, interventions for decreased cardiac output, arrhythmias, so study EKGs, identifying cardiac arrhythmias, ABGs, ABG imbalances, ischemic stroke and how to identify an ischemic stroke, the signs and symptoms of them, and managing an ischemic stroke, knowing the signs and symptoms and how to manage them. Identifying communicable diseases having to do with bioterrorism. So going back and forth with the NCSBN website, what it has listed here under physiological adaptation, and using your ATI comprehensive report, your topics to review, I hope that helps narrow down where you need to focus on first in order to help you prepare for your next test and the NCLEX. Wish you so much luck. Thank you so much. Take care.